Can we finally get common sense on COVID policy? Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. 2022 should be the year when the COVID-19 pandemic becomes at worst an endemic, something that no longer enormously disrupts our lives. Most of us will be able to get about our lives in a more normal fashion. Fortunately, the latest variant, Omicron, while virulent, is more like a flu or bad cold than its often debilitating and deadly predecessors. Knock on wood, the worst should be over by the end of the month. The vaccines have undeniably and enormously reduced hospitalizations and deaths. Unlike 2 years ago, we also have powerful therapeutics today. Moreover, a second generation of vaccines is coming that promise to be effective against all current and future variants. Unfortunately, the response of our political and public health leaders has too often been pockmarked by harmful and capricious mandates. Such arbitrary actions continue and must be stopped. Take lockdowns. Real-world evidence, going back to late spring 2020, demonstrated that lockdowns didn't stop the disease. At best, they delay the spread. But they impose immense costs in terms of lost schooling, unemployment, bankrupted businesses, massive government spending and money printing, and upended supply chains that have ignited a scale of inflation not seen in 40 years. The damage to mental health and to undiagnosed and untreated illnesses has been immense. Policymakers forget that public health is not only COVID-19, but all other illnesses. Yet lockdowns persist in places like Austria and Holland. Certain officials here are tempted to resort to them with the Omicron outbreak. Policy on masks has been a harmful mess. There is scant scientific basis for mandating masks for kids under the age of 12 in schools. An independent study in Florida, for instance, found no difference in case rates for school districts that required masks and those that did not. Given their excellent ventilation systems, masks need not be required for airline flights. Vaccine policy has also been off the rails in certain areas. Requiring youngsters to get vaccinated is medically unjustified except for special circumstances. Finland, in fact, has banned such vaccinations except for particular cases. President Biden and the federal government have miserably mishandled the Get Vaccinated campaign. The public shaming and Biden's sweeping unconstitutional executive orders that took no recognition of the real immunity conferred by having the disease have stiffened resistance and have harmed the economy by forcing people out of the workforce. Patient persuasion, which took place successfully in countries like Spain, would have been more effective. The CDC and the FDA also need overhauls, as evidenced by the notorious botched development and distribution of tests in early 2020. More recently, highly effective therapeutics from Merck and Pfizer were unnecessarily delayed by the FDA, thereby costing lives. For the sake of all of us, let's hope good sense will ultimately prevail in this new year. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.